So Donald Trump had another humiliating 24 hours ending yesterday on the eve of the Republican National Convention, which starts tonight. First, of course, Trump golfed on Saturday as the coronavirus death toll reached and surpassed 180,000 deaths. OK, we're a global embarrassment. Trump is still golfing. Don't need to spend a lot of time on that. Sunday, Trump announces a big press briefing. Huge medical announcement is going to be made. Big treatment news about coronavirus. Wow. What could that be? They schedule it for 5:30. Word leaks. The announcement is an FDA emergency use authorization for convalescent plasma. What? That's been around as a coronavirus trial treatment for months. Tons of countries have been using convalescent. How is that an announcement that Trump? What? That is what it was. Donald Trump trying to take credit for something he had nothing to do with, isn't news, and isn't unique to the United States. And of course, Donald Trump continues to mispronounce the word plasma as plasma 7 times, in fact, during this announcement. Here is Trump struggling to even read what the announcement is.
Truly historic announcement in our battle against the China virus that will save countless lives. The FDA has issued an emergency use authorization, and that's such a powerful term, emergency use authorization for a treatment known as convalescent plasma.
Why can't somebody tell him it's plasma? Is that like when you forget someone's name the second time you meet them and you don't want to ask? And then you've met them 10 times and now it's too late to ask. And at this point, nobody wants to be the person to go up to Trump and say, sir, as Trump says people talk to him, sir, it's plasma, not plasma. Then, more importantly, substantively, Trump exaggerated the benefit of plasma, or plasma, as it may be.
Vaccine to save lives. We're removing unnecessary barriers and delays, not by cutting corners, but by marshaling the full power of the federal government. We provided $48 million to fund the Mayo Clinic study that tested the efficacy of convalescent plasma for patients with the virus. Through this study, over 100,000 Americans have already enrolled to receive this treatment, and it has proven to reduce mortality by 35%. It's a tremendous number. The FDA, MIT, Harvard, and Mount Sinai Hospital have also found convalescent plasma to be a very effective method of fighting this horrible disease. Based on the science and the data, the FDA has made the independent determination that the treatment is safe and very effective.
Now, there are actual questions about whether this emergency use authorization makes sense. So to remind you, this is a trial treatment that's been around the world for months. There's nothing special about the U.S. trying convalescent plasma. There's a good thread on Twitter which explains that by giving an emergency use authorization, you're making the treatment available to way more people who aren't actually that sick and who would likely recover anyway, and could end up skewing the results and exposing people to some pretty serious side effects, which can include, as a result of these plasma transfusions, lung injury, blood clots, kidney issues, etc. So one of the reasons you would maybe not do an EUA early is that when you keep the treatment as part of randomly controlled trials, you're actually carefully selecting sicker patients where you need something extra. I have a relative in Argentina who has coronavirus right now, and they would have been able to give her convalescent plasma, but they decided she's not sick enough. And because there are side effects, we don't want to just start giving it to everybody at this point in time. You don't want to put people who aren't that sick at risk of dangerous side effects and skew the results by giving the treatment to people who are less sick and likely to recover anyway. When you have an emergency use authorization, people start asking for this. It's more available. You start giving it to people who aren't that sick. You end up with people with side effects that didn't really need the treatment, and the treatment can appear more effective than it is, all because Trump wants something to announce. Okay, so then Trump takes just 3 questions at a completely non-newsworthy press briefing. One of the questions is from right-wing propaganda network OAN. And then he walks off so quickly after only 3 questions that you can tell The other people on the stage are surprised that that's it. Trump's leaving. Take a look.
Very much. Great question.
Was there pressure on you, Dr. Hahn, to authorize this? Mr. Dr. Hahn, could you answer that question? Was there pressure, Dr. Hahn, to authorize this? You didn't answer the question. None of you answered the question.
So that was part one of Trump's late afternoon. Then Trump was interviewed by this horrible Fox News host, Steve Hilton, and it was just a train wreck yet again. This was another one of those interviews meant to be easy that just goes bad for Trump. Trump has been asked about and has failed to answer. What's your biggest accomplishment from your first term? Trump in the past has given no answer multiple times to that question. This time he had an answer, and comically, it was worse than no answer at all. Trump says his big accomplishments are healthcare and transparency. Listen to this.
With healthcare, we've done a great job. One of the other things I did, I think the future is good. Transparency. I approve transparency. That's bigger than healthcare. The people I had working on it, one of them is like the all-time expert on transparency, a highly respected man, doctor. He said, sir, if you get this approved, this is bigger than healthcare. Transparency, where you can go and negotiate and pick the best doctor.
Explain why that helps people.
Because people will be able to negotiate their prices, which right now they can't. People will be able to get better doctors. You know who it's good for? Good hospitals. By the way, hospitals are against it because it makes them good. Good hospitals and good doctors. It's good for good hospitals. It's the biggest thing maybe in healthcare of anything I'm doing.
So let's think that through. Healthcare. Trump tried twice, I believe in 2017, to get a plan passed that would replace Obamacare with something that will lead to 24 to 32 million people losing healthcare. Then what he did on healthcare is strip the mandate from Obamacare, which merely makes Obamacare function worse. It doesn't actually get rid of it. It just makes it function worse. Then he says transparency has been an accomplishment. I don't even have to get into that. I mean, Logan Act, Hatch Act violations, lining his pockets and those of his family and friends, not showing us his taxes, not cooperating with multiple investigations. So his accomplishments, he says, are healthcare and transparency. Out of this world. And then again, Trump says he's been the best president for black people in history, other than maybe Abraham Lincoln.
What do you have to say to people who want both law and order and racial justice?
First of all, I think I've done more for the black community than any other president other than perhaps Abraham Lincoln. And I think it's true with criminal justice reform and opportunity zones and all of the things I've done, prison reform. I mean, what I've done is more than anybody else. I don't know if it's being recognized at all.
This little clip, those 23 seconds, are everything that Trump is. I've done the most of anybody, and nobody gives me credit. That is the Trump presidency in a nutshell. Failing on everything while claiming success and claiming nobody's giving you credit for that success. Another disastrous day for Trump by normal people's standards, leading up to the RNC, which starts tonight. It's going to be wild. It's going to be wild. Make sure you're following me on Twitter at @Pakman. I will be tweeting during the RNC and live streaming. I hope to see you then. One of our sponsors is privacy.com. They're giving you $5 when you sign up for their completely free service at privacy.com/Pakman. I've been using Privacy for a little over a year now. You've heard me talk about it before. It's a lifesaver, and here's how it works. It takes just a couple of minutes to set up. Anytime you buy something online or on the phone, instead of actually using your real credit card number, the Privacy app and the browser plugin let you give each company a randomized virtual credit card number that you create out of thin air. It'll even autofill the card number with one click. And the payment is taken out of your checking account without the merchant ever knowing your real information. So this allows you to keep your banking information secure, but also to take control of your finances. You can create up to 12 of these virtual credit cards a month. You can set spending limits. You can freeze them. You can delete them anytime you want. So when you do this, it means you're not going to be charged when you don't want to be, because you can destroy the virtual card number right after using it, which, for instance, I love using free trials because I know I won't be charged when the trial is over if I use a virtual credit card number. You're keeping your identity private by not telling companies who you are. You're keeping your bank or credit card info protected against data breaches and identity theft, and it's free. There's no catch whatsoever. But if you want, Privacy also offers a $10 a month plan that gives you 1% cash back and lets you create 36 credit cards a month, and a $25 a month plan tailored more for small businesses where you can create 60 card numbers a month and much more. But definitely go ahead and at least get started with the free plan. You'll protect your financial info. Companies can't charge you unexpectedly. And like I said, you'll get $5 to spend when you sign up at privacy.com/Pakman.